I'm a bit frightened actually. Will the hospitals be able to cope? What's going to happen really? People possibly we're coming into contact with who haven't been vaccinated and we may get COVID from them.
They're in lockdown now, but Karen McKenzie is worried about restrictions easing. We first met Karen and her autistic son Jared in November 2020. They just recovered from COVID-19.
It's hard to believe that it's actually been a year. It was just quite scary at the time.
It was a disability support worker, one of two employed to assist Jared, who brought the virus into their home.
It was a difficult time, that's for sure, and something I don't want to go through again.
Karen and Jared are now fully vaccinated, as are their current support workers. But one of their staff who caught the virus last year refused.
So I was quite surprised that he didn't want to get vaccinated, given that he was actually sicker than the rest of us by a week longer, but he has his reasons.
That support worker is no longer assisting Jared. Despite 5 years with the family, he posed too great a risk unvaccinated.
And as a mum, you must be very worried about Jared in terms of when things do open up again.
Yes, I am. Look, because he won't wear a mask for a start, he's got a higher chance of possibly getting it. So if he goes to a park, we'll have to decide whether there's too many people there or shopping centre or things like that.
As the world opens up and they want to go out into the community, it's really deeply concerning that 20% of the community that they'll come in contact with will not be vaccinated. And 1 in 5 is an unacceptable risk for people with disability.
Able Australia provides disability services in Queensland, Victoria, Tasmania and the ACT. Its CEO says all providers are working extra hard to protect clients and staff.
I think really sadly the fact that they are still not considering the vulnerability of people with disabilities, that the government response has not been adequate. In fact, it has been woeful in some aspects.
Seriously deficient is how the Disability Royal Commission described the vaccine rollout to the sector in a recent report. It found the Health Department deprioritised the vaccination of people in residential disability accommodation from Phase 1A.
I fail to see why 26,000 people were deprioritised. I think a larger question really is the 4.4 million people with disabilities. I want to know what the government's plan is to ensure that those people have had real opportunity to get a vaccine.
The Commission recommended the government should not allow restrictions to be eased at 70% vaccinated unless it was satisfied that all people with disability had been given the opportunity to be fully vaccinated and all disability support workers were fully vaccinated. To do otherwise, the Commission said, would be grossly unfair, indeed unconscionable.
So it is disappointing, I think, to get to a point where we recognise that for a vulnerable population, we've lacked the reach and the urgency required to really provide protection.
Professor Julian Troller is part of the group providing advice from the sector to the Federal Health Department about the rollout to people with disability.
Whilst we've come up with many solutions and clear recommendations, those haven't necessarily been heard and actioned at the next level because there have been multiple competing demands and a pressing priority for the general population. This means, I sense, that the needs of people with disability have been unprioritised or deprioritised.
A spokesperson for the Health Minister said the disability community was prioritised in both Groups 1A and 1B and have remained a priority throughout the rollout. Any statement to the contrary is false. 78.1% of NDIS workers have received a first dose and 65.3% a second, above the national average. For people with disability in group homes, 81% have had 1 dose and 73% are fully vaccinated, 11% higher than the national average.
I'm really nervous about it. I don't think there's been a lot of thought or consideration given to the risks of people with so-called underlying health conditions.
You have a lot of things to say, Papa.
Even though restrictions are easing in Sydney, for the Myers family, life continues largely in isolation.
That's funny.
While mother Fiona and her husband are vaccinated, the children are all too young.
Do you want to go ding the bell?
2 live with disability, and heading back to school may expose the family to the virus.
Yay! Go cool!
Once school returns, there won't be any home learning. And I have yet been able to get any answers as to what that looks like for us, whether we do have to withdraw the kids' enrolment and officially homeschool them.
Fiona Myers is particularly concerned for her youngest, 4-year-old Corbin, who lives with multiple complex disabilities.
If you're happy and you know it, clap your hands.
The family has a team of 9 support workers, and while they've all been vaccinated, the risks are high.
So as everyone else starts to open up, we're conscious of the impacts of what those people are doing with their family, what their kids are doing with their friends, and the risk just becomes bigger.
Fiona hopes people understand their family life is not the same as others.
While they might have all of these freedoms, to stop and think for a second on the impact that might have on someone like Corbin, because he is just as deserving of a good life as anyone else.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.